Introduction to Ethics in Nursing. Ethics. Ethics is the study of good conduct, character, and motives. It is concerned with determining what is good or valuable for all people. Bioethics. Bioethics is built on the foundation of professional ethics in healthcare. The field of bioethics guides discourse about difficult issues that arise in healthcare. Nurses must understand the law to protect themselves from liability and to protect their rights. Nurse need not fear the law but view the information that follows as the foundation for understanding what is expected by our society from professional nursing care providers. Licensure permits person to offer special skills to the public but also provides legal guidelines for protection of the public. Ethical principles. Autonomy. Autonomy refers to a person's independence. Autonomy is the freedom to decide and act. Autonomy represents an agreement to respect another's right to determine a course of action. Respect for another's autonomy is fundamental to the practice of health care. Beneficence. Beneficence refers to taking protective actions to help others. Beneficence encourages to do good to others. For an example, immunization, a nurse will not simply carry out medical orders, but act thoughtfully to understand patient needs and to help meet those needs. Non-maleficence. Maleficence refers to harm or hurt. Non-maleficence is the avoidance of harm or hurt. Ethical practice involves not only the will to do good but also the equal commitment to do no harm. Justice. Justice refers to fairness, equal distribution of resources. For an example, who should receive the available organs for transplantation. Professional nursing. Code of ethics. A set of ethical principles that are accepted by all members of a profession. A profession's ethical code is a collective statement about the group's expectations and standards of behavior. Codes serve as guidelines to assist nurses and other professional groups about correct practice or behavior. For an example, the International Council of Nurses have established widely accepted codes that professional nurses attempt to follow. Codes of different countries may differ in specific emphasis, but they reflect the same basic principles: veracity, fidelity, confidentiality, advocacy, accountability, responsibility. Veracity. Veracity in general means accuracy or conformity to truth. It is another aspect of reliability. Veracity guides nurses to practice truthfulness. Fidelity. Fidelity refers to the agreement to keep promises. A commitment to fidelity explains the reluctance to abandon patients, even when disagreement arises about decisions that a patient may make. Confidentiality. The rights and privileges of patients for protection of privacy without diminishing access to quality care. For an example, healthcare information, including laboratory results, diagnosis, and prognosis, is not shared with others without specific patient consent. This includes preventing other family members or friends from acquiring patients' information. Advocacy. Advocacy refers to the support of a particular cause. As a nurse, you advocate for the health, safety, and rights of the patient. Your relationship with the patient provides you with knowledge that is specific to your role as a nurse, and as such provides you the opportunity to make a unique contribution to understanding a patient's point of view. Accountability. Accountability refers to the ability to answer for one's own actions. The nurse is accountable to the patient, the profession, the employer, and the society. Responsibility. Responsibility refers to the characteristics of reliability and dependability. Ability to distinguish between right and wrong. For an example, when administering a medication, a nurse is responsible for assessing the need for drug, giving it safely and correctly, evaluating the response to it. Acting responsibly, the nurse gains trust from patients, colleagues, and society. That's all for today. Please like, share, subscribe and turn your notification on if you like the video. Thank you. Introduction to Ethics in Nursing. Ethics. Ethics is the study of good conduct, character, and motives. It is concerned with determining what is good or valuable for all people.